Root canals. I'd like to introduce this topic with a real case from my office. A 42-year-old white female was referred to me by her primary care physician. He was intuitive enough to recognize that her root canal might be associated with her medical condition. The first words that this patient said to me were, "Dr. Garcia, I want to take these cadavers out of my mouth." It took me a few seconds to understand what she meant, and then I realized that she was referring to her root canals. Let me educate you about root canal teeth so that I can help you understand why this patient refers to them as cadavers. Each tooth in your mouth is an organ that is associated with a blood supply, venous drainage, lymphatics, and nervous innervations, just like your heart, lungs, kidneys, etc. In addition, a tooth is an energy system that is connected to a meridian, which is a complex flow of energy canals that are connected from the tooth to other areas of the body. A root canal tooth can alter this energy flow and affect other organs and all body structures that are connected to that particular tooth. A tooth has a vast network of microscopic canals called dental tubules that can extend from 3 to 9 miles. If a nerve of a tooth is damaged in any way, either by fracture, infection, or extensive decay, then the tooth is compromised. Conventionally, a root canal is performed. This procedure tries to clean the nerve out of the canals of a dead or dying tooth. Once this is done, the tooth is dead. And this is why my patient referred to it as a cadaver. When a dentist performs a root canal procedure, he or she cleans the most central canal and tries to sterilize it with chemicals, antibiotics, laser, or ozone therapy. But remember, a tooth is a vast network of 3 to 9 miles of microscopic canals. Therefore, it is impossible, even with the most perfect root canal procedure, to penetrate and sterilize all of these canals. As a result, microorganisms that are trapped in this vast network of canals mutate and learn to thrive in the absence of oxygen. They become stronger and produce even more potent toxins that diffuse out of the tooth and into the rest of the body through the lymphatics and blood supply. These toxins also alter the energy flow from the tooth's meridian that is connected to a particular organs or structures. To illustrate this, I'd like to share another patient's experience. Another woman in her early 50s presented to my office after consulting with many other physicians for chronic swelling in her left leg. Fortunately, one of the many physicians asked her if she had a root canal, which she did, and referred her to my office. This patient had no history of pain in the root canal tooth, nor were there any signs of infection on the X-ray. After a careful evaluation and understanding that the tooth may be associated with the swelling in her leg, the patient decided to extract the root canal tooth. I extracted the tooth, and one day following the procedure, her husband noticed that the swelling was gone. He actually made the comment that her leg looked very sexy. To this day, her leg is normal. As is the case with this patient and many others with root canal teeth, the consequences of this procedure might go unnoticed, with no signs or symptoms for several years, until some stressful event or series of events like an illness, loss of job, divorce, or death in the family sends them over the edge. This event or events challenges their immune system to the point where the body is so overwhelmed that it's no longer able to neutralize the toxicity of the root canal tooth. The body weakens, inflammation builds, and more toxicity inundates the individual from the dead tooth. This can open the door for more serious illnesses like cancer and autoimmune disease, and recovery becomes more difficult. Holistic physicians and holistic cancer clinics around the world routinely advise their patients to remove root canal teeth, mercury, and shiny metals prior to initiating any time of treatment so that the patient is better equipped to heal from their illness. I highly recommend that you, your family, and your friends read my book and become aware of your dental choices. Well-educated choices may result in health rather than disease, longevity instead of premature death. May you continue to watch, listen, learn, and be empowered. Join me in waking up our nation in search for health and true freedom. Thanks.